Hi everybody, welcome back. This is Dr.Surindher here, your friendly neighborhood plastic surgeon. So today we're going to talk about man boobs, very common problem, also called as gynecomastia. So what exactly is gynecomastia? Gynecomastia is basically the chest area when it is enlarged in men. So that's called a gynecomastia. There are two. So what are the types of gynecomastia? When we talk about, as I said, one is a true gynecomastia where there is glandular enlargement and it's painful, and it usually occurs in the younger age group, just as during puberty. This is one of the surgeries that we do even in younger age group, a cosmetic procedure, but it is done in the younger age group as well because it causes a lot of psychological trauma. So that is why this is a procedure that we operate even in the younger age group. So whenever you have a problem, then you can do the surgery for it. And of course, the other gynecomastia or the false gynecomastia, the most common one that we see is basically because of persistence of the changes which occur during adolescence, or maybe because of weight gain, because of dietary habits, because of your own habits. So that is when you tend to gain weight. And when we talk about the type of gynecomastia, there is also a type as to whether it is purely glandular, which is what the true gynecomastia is, or it could be lipoglandular, which is most commonly found or which is seen in the older age groups. A common trend that is followed especially with the youngsters in the 20s or 18 to 25, 27, 28 when they are going to the gym. Active gym goers, when they talk to their trainers and they say, okay, yes, your chest is the one which is a problem, so what you do is you do a chest workout and you work yourself out and you do it. So does exercise help? To a certain extent, yes, exercise does help, but that is mainly in when you reduce your weight, the exercise and diet, so the fatty component might reduce. But if you're doing your exercises, the main issue is try not to do any chest exercises. The reason being that if this is your muscle or the pectoral muscle, and then this is your gland and the fat which is sitting on top of it. So what happens is when you start doing chest exercises, the pectoral muscle becomes more stronger and pushes this gland and tissue out. So in fact, when you do your chest exercises, it tends to show up even more than what you did before. So if at all gynecomastia and you want to see if exercise helps, so then what you do is you do exercises where you burn fat and you do your diet so that some of the fat goes down, but it doesn't treat the glandular component, but the fat does go down. So then it will look less obvious. But if you have a gynecomastia, please do not exercise your chest muscles because that is going to make the muscle more prominent and push it out further and make it look more obvious. So most commonly what we see is there are two subsets when we talk about the age groups. One is just after puberty, so that is the time when because of the hormonal changes there is some glandular enlargement which happens, and then in the area or in the age by around 22 or 23 it should resolve by itself, but if it persists after that then it just tends to stay. And then the second age group as we see is later in life, that is plus 40, 45, when as we're aging because of hormonal changes, again there tends to be an increase in the fatty component as well as the glandular component which can happen. Who needs the treatment for gynecomastia? So it could be, as I said, any age group, but it is basically whether the gynecomastia is becoming a trouble for you or it is looking awkward for you. So there is no medical problem because of it. So there is no medical indication for the gynecomastia except for maybe true gynecomastia when you have pain. But apart from that, it is more of a personal choice. Yes, if you don't like how the body looks, or you're embarrassed about removing your shirt, or embarrassed about going to the pool or the beach, then yes, that is the time to do some treatment for it. So coming to the treatment part of it, so what is the treatment or what is the solution to this? So the solution, as I said, it all depends on whether it is not a medical indication. It is more of a cosmetic indication. So if you have a problem with the chest, how it looks, then yes, we can go ahead and treat it. Surgery is the gold standard. because there we are actually doing two things. One is we are removing the fat which is on the surrounding area, and then we remove the gland as well. So once we have removed the fat as well as the gland, then there is no chance for it to recur. But yes, there are certain things that you have to look into when you go in for a gynecomastia surgery. You need to go through to proper trained people, because it is not just scooping out tissue, you also have to even things out, and that is where the art of the procedure comes in, where you make the chest look even and make the chest look normal rather than having a hollow there. And so when you scoop it out or you remove the gland just in the center and then you don't do anything for the surrounding area, then it becomes a hollow and it looks even worse than how it was before. And the second thing, of course, is to technical procedures as to how it's done, whether you're using a drain, whether the drain is not there, those kind of things that you have to look out for. So talk to your surgeon about it and get your proper idea about what is to be done, how it's going to be done, and where it's going to be done. Another common question we get is, are there going to be scars after gynecomastia surgery? All surgeons do it differently, and the way we do it is there are no scars. The scars are hidden basically, so we do it from around the nipple, so you don't have any permanent scarring, and we don't use drains, and we do a combination of liposuction plus a gland excision, and so that is why it minimizes your recovery time, and you can get back to your activities faster. Any surgery, yes, you have to be prepared and you have to be looking after it to allow it to heal ideally and in the proper way. So there are a few things that you have to do. One is wear your pressure garment diligently and wear it as long as possible. The longer you wear it, it tends to give you a better shape and it prevents your swelling. Secondly is once the sutures are out, that is after 7 or 10 days, we need to start you to do exercises. Chest exercises, basically push-ups or bench presses. Here a point to note is I prefer not to do it with a with a machine. I would prefer that you do it with individual barbells or not do it against the wall as well. Typically what we see is a person is either right-handed or left-handed, so you tend to push more when you're doing these exercises with the dominant hand. What happens is that makes the dominant side more prominent, or the muscle buildup is more as compared to the non-dominant side. So that is why I prefer to tell you to do bench presses, but do it with individual dumbbells so that you have equal weights on both sides, so that the chest or the muscle develops equally. Apart from that, there are no major things that you need to be looking out for. And of course you need to still have a better healthy lifestyle, and you have to look after yourself and what you put into your body so that you can maintain the result. Typically this procedure is a permanent procedure. It's once it's done, it's permanent, except you will gain some amount of fat as you get older or you don't look after yourself. So that might get you might get a little bit of a bulge there as you gain weight, but it still won't go back to how you were before, because the gland part is removed, that doesn't come back, but the little bit of fat that we do leave behind to smoothen the area and to contour your chest, so that can still gain weight. So you can gain weight in those fat cells. So that is why you need to maintain. Maintenance is also key. Another query is, can I start exercising after gynecomastia? So this is actually a very important part after any liposuction procedure, and it works here as well. So what we would suggest is immediately after the surgery, for the first week, of course, we put you on a pressure garment or a vest that you need to wear. So that helps you with compression of the chest and compression of the skin and prevent the swelling from coming in, and it also prevent any collections. Secondly is, as once the stitches are out and by about a week, or 10 days you can start your exercises. And in fact, we encourage you to start exercises, because the first 3 months as it is healing, we have removed tissue from there, so there is an empty space and there is some loose skin, so that needs to shrink. And secondly, you need to build up muscle to fill up that area from where we have removed the gland. So this will happen as you do your chest exercises. So immediately following surgery, that is from 10 days onwards till the next 2.5 or 3 months, you need to concentrate on your exercises so that you build up muscle, the chest contours better, and then your healing is also faster, because now there is more circulation there, the swelling is faster. But you have to wear your pressure garment always, and that will also help you enhance the results. So as I mentioned, it is a very common procedure. It's a very common problem. We get a lot of patients for gynecomastia surgery, and it's not a very major issue where you have to be worried. You can get back to activities quite soon. Within 2 to 3 days, you're back to all your normal activities. Exercising maybe after a week or 10 days. And the only thing is, look after yourself during the healing phase and do your exercises so that you get the best results. And of course, depending on what your grade is, how big or small it is, once we examine you, we will tell you all those details as to what especially you have to look out for. The younger you do it, you have better skin quality, so the shrinkage is much better. Very rarely in huge gynecomastias or people who have had a bariatric procedure where there is a massive weight loss, there might be a lot of skin excess. When we do a lot of skin excess, then yes, you might have to do something called upper body lift, or you might have to do a circumarular gynecomastia reduction. So there might be some extra scars, and the healing time also may be prolonged. But that's a totally different subset of population. Most commonly, when you talk about gynecomastia, it's a daycare procedure with literally no scars, and the scars are hidden. So that was just about what gynecomastia is and what your options are. And if you have any other queries, drop us a line and we will definitely get back to you. Thank you for being with us. And